Okay, so nosebleeds. It's not exactly like the most fun thing to talk about, right?
Yeah,
But it's something that I think we've all probably dealt with at some point. And today we're gonna like really dive deep into the world of nosebleeds.
absolutely.
We're going to try to figure out like what they are, why they happen, what you can do about them. And we've got some really interesting sources here that we're going to pull from covering everything from the basics, what is a nosebleed, all the way to some like surprising natural remedies. There's even like a connection to oral health, believe it or not. So are you ready to get started?
Oh, absolutely. Let's dive in. I think it's really important to, like you said, not just jump to how to treat something, but really try to understand like what is causing this.
Yeah.
And there's just so much to unpack with nosebleeds.
Totally. Okay, so first things first, like what are we actually talking about here?
Yeah, so I mean, the medical term for a nosebleed is epistaxis,
Yeah.
but we can, just
Let's stick to nosebleed.
yeah, we can stick to nosebleed for sure. But essentially, it's bleeding from the blood vessels inside your nose.
Okay. Okay, that makes sense. And there are different like types of nosebleeds, right?
Yes, exactly. We've got two main types, anterior and posterior. So anterior nosebleeds, these are the ones that are most common. They happen in the front part of your nose,
Mm-hmm.
and these are the ones that, a lot of times you can handle at home.
Mm.
And then you have posterior nosebleeds, and these occur further back in the nasal cavity. And these can be a bit trickier.
Okay, so if most nosebleeds are happening in the front of the nose, like why do they even happen there? Is it just dry air? Like, is it just dry air?
Dry air is a huge, huge culprit. So the lining of your nasal passages is really delicate. It's filled with these tiny little blood vessels. And when the air is dry, those blood vessels can become brittle and they crack easily. So almost like chapped lips, but inside of your nose.
Ooh, yeah. I can relate to that. I remember I lived in Arizona for a year and oh my gosh, my nose was constantly like dry and irritated.
Yeah,
It felt like sandpaper. I mean, I became best friends with my humidifier.
absolutely. That's
Yeah.
that's exactly what you need because
Yeah.
it adds moisture to the air, and that can really help prevent those blood vessels from drying out and cracking.
Okay. So dry air is a big one. What about other things that could like irritate the nasal passages? I see things like allergies and, oh my gosh, even picking your nose mentioned in the sources.
Yeah, those are definitely important ones too. So, allergies, they cause inflammation in the nasal passages.
Hmm.
And when those passages are inflamed, they're more vulnerable to bleeding. And then, picking your nose, yeah, we all do it. But really, you're directly damaging those delicate blood vessels when you do that.
Yikes. Okay, noted. I'm guilty of picking my nose sometimes, but I will think twice next time. Okay. What about things like high altitude? One of the sources mentioned that could be a cause too.
Absolutely. So when you're at a high altitude, the air pressure is lower, the air is thinner, so there's less oxygen, right? And this can dry out your nasal passages, just like in dry climates. And it can definitely make you more prone to nosebleeds.
So even if you're like just on a ski trip or something?
Yeah, definitely. If you're not used to it,
Yeah.
especially, yeah, and you're not taking care to, make sure you're getting enough fluids, um, it's possible for sure.
Wow. Okay, that's really good to know. And I also see medications listed as a potential cause too. Could you explain that a little bit more?
Yeah, so certain medications, like blood thinners, for example, can make it harder for your blood to clot. And this is, really important for people who have certain health conditions. But this can also make you more susceptible to nosebleeds because if a blood vessel in your nose does break, it'll take longer to stop bleeding.
Okay, that makes sense. And what about decongestants? I feel like, those are something people use all the time for colds and allergies.
Yeah, good point. Decongestants can actually dry out your nasal passages, which, as we've talked about, can make you more prone to nosebleeds. So it's almost like a catch-22 there. You're taking it to relieve congestion, but it could actually be making you more susceptible.
So it really is kind of like a detective game, isn't it? Figuring out what the culprit is in your specific case.
Yeah, absolutely. It's about thinking about, your environment, any medications you might be taking, and even your habits. So, yeah, and any of these factors kind of resonate with you at all?
Definitely some food for thought there. But I think it's also important to point out that like sometimes, nosebleeds can be a sign of something more serious, right?
Absolutely.
Yeah.
While most nosebleeds are totally harmless, they're easily treated. Um, Sometimes they can be a symptom of an underlying medical condition.
Okay.
So things like high blood pressure, blood clotting disorders, even nasal polyps, these can all contribute to, more frequent nosebleeds or more severe ones.
So what is a blood clotting disorder exactly?
So basically, it's a condition that affects your blood's ability to clot properly. There are various different types, and some people are born with them. Some people develop them later in life. Um, but the key takeaway here is that if you have a blood clotting disorder, even a minor injury can lead to, prolonged bleeding, and that includes nosebleeds.
Okay, okay.
Mhm.
That's really helpful to know. So let's say you're having a nosebleed. Like what's the best way to stop it?
Yeah, so for those common anterior nosebleeds, both of our sources recommend some pretty straightforward first aid steps.
Okay. Great. Like walk me through it.
Yeah, so the first thing you want to do is sit upright and lean forward slightly. And this is going to help prevent blood from, dripping down the back of your throat, which can be, not only unpleasant, but it can even make you nauseous.
Yeah. Right. Okay. What's next?
Then you want to gently pinch the soft part of your nose, right above the nostrils, and hold that for about 10 to 15 minutes.
Mm.
And this just helps apply pressure to those bleeding blood vessels and allows a clot to form.
Okay. And I assume you should, breathe through your mouth during this time.
Absolutely, yeah. And try to just stay calm, relaxed. I know it can be kind of a scary thing when it happens. But, panicking is only going to increase your heart rate. It could actually make the bleeding worse.
Right. Good point. Okay. So pinch, lean forward, breathe. Got it. But what if it keeps bleeding, like even after 15 minutes of, applying pressure?
Yeah, that's a good question. So it's really important to remember that those first aid tips are really just for minor anterior nosebleeds. So if the bleeding doesn't stop after 15, 20 minutes, or if it's really heavy, like particularly heavy, or you have other symptoms along with it, like dizziness, weakness,
Hmm.
you should seek medical attention immediately.
Okay. Okay. Speaking of more serious cases, we talked earlier about posterior nosebleeds. Like what makes those, potentially more dangerous?
So those posterior nosebleeds, they often originate higher up in the nasal cavity, which makes them harder to, reach and control with just, those simple first aid measures.
Right.
They can also be more likely to be a sign of an underlying issue,
Okay.
something that requires medical attention.
So if you think you're having a posterior nosebleed, it's best to head straight to the doctor.
Yeah. Definitely don't try to treat that at home. Medical professionals, they have specific techniques and tools to manage those. And they can also investigate what the underlying cause is, to make sure you get the right treatment.
That makes total sense. Okay. So we've talked about the what and the why of nosebleeds and what to do when they happen. But what about preventing them in the first place? Are there things you can do to reduce your risk?
There definitely are. I mean, prevention is key,
Yeah.
and it can be as simple as just making some small changes to your daily routine.
Okay, so we're talking prevention. What are some of the best ways to keep those nosebleeds at bay?
Well, I think one of the simplest things you can do, but also one of the most effective, is stay hydrated.
Hmm.
I always like to think of your nasal passages kind of like a delicate garden. If you don't water it enough, the soil dries out and the plants get all brittle.
Oh, that's a great analogy. So how much water are we talking about here? Like
Yeah.
8 glasses a day or?
Yeah. I mean, that's the general recommendation, but, it really can vary depending on your activity level and, the climate, other factors. Just listen to your body. Drink when you're thirsty.
Okay, got it. And we already talked about humidifiers being helpful in, dry climates. What about things like saline nasal spray? I see that mentioned a lot.
Yeah, saline nasal spray is a great way to add moisture directly to those nasal passages. So it's basically just a saltwater solution, and it helps to, soothe, moisturize those delicate blood vessels.
Okay, so they're thinking it like a gentle mist for your nose.
Exactly. And unlike some of those decongestants, it's not going to dry out your nasal passages.
Okay,
Yeah.
good to know. And what about just avoiding nose picking? I know it's tempting, but it sounds like that's a big no-no when it comes to preventing nosebleeds.
Absolutely. Picking your nose can damage the lining of those nasal passages, making them much more prone to bleeding. So best to resist the urge and use a tissue if you need to clear things out.
All right, so stay hydrated, use a humidifier if needed, saline spray's our friend, and hands off the nose. All great tips for prevention. Now I want to circle back to something you mentioned earlier, honey. One of the sources mentions it as a potential natural remedy, and I'm really curious to learn more about that.
Yeah, honey's really interesting. It's been used in traditional medicine for centuries. And, for good reason. It has antibacterial, antiviral, antifungal properties.
Wow. That's quite a resume. But how does this relate to nosebleeds?
Well, this particular source actually focuses more on honey's potential benefits for oral health, so it might seem a little bit off topic at first.
I was just thinking that, like, what does oral health have to do with nosebleeds?
That's a good question. And, I think it highlights just how interconnected our bodies really are. So, the source suggests that honey can be beneficial for things like, soothing canker sores, helping with gum disease, even loosening plaque and tartar. And they actually recommend using it as a mouthwash, gargling with it, even rubbing it on your gums.
Okay. So the idea is that by, improving your overall oral health, you might be like indirectly reducing your risk of nosebleeds.
Yeah, that seems to be the suggestion. Although it's important to note that there's no strong scientific evidence, to support a direct link between honey and nosebleed prevention. However, taking care of your oral health is definitely beneficial for your overall well-being, and it's certainly a practice worth considering.
Okay, so while honey for nosebleeds might be a bit of a stretch, using it for oral health could be a good idea. What about the other natural remedy mentioned, fasting? I'm really intrigued by that one.
Yeah, so this source mentions fasting as a potential natural treatment for nosebleeds. Specifically, they talk about Islamic fasting from dawn till sunset and intermittent fasting.
Wow, fasting for nosebleeds. I've never heard of that before. What's the thinking there?
Honestly, I'm not entirely sure. There's really no scientific evidence to suggest that fasting directly prevents or treats nosebleeds. It's possible that, this is based more on traditional beliefs or anecdotal evidence rather than, solid scientific research.
So you're saying it's more of like a folk remedy than like a proven medical treatment?
Exactly. And it's always important to be cautious with claims like this, especially when there's, no scientific backing.
Yeah, no, that's good advice. But I'm still kind of curious, like could there be any indirect benefits of fasting that might relate to nosebleeds?
Well, some studies have shown that fasting can have positive effects on things like blood pressure and inflammation, both of which could potentially play a role in nosebleed frequency. But again, more research is needed to confirm any, direct link.
So while we can't say for sure that fasting will prevent nosebleeds, it's certainly true that taking care of your overall health is never a bad idea.
Absolutely.
And that includes things like, maintaining a healthy weight, managing your stress levels, getting enough sleep.
All of those things contribute to, a healthy body. And a healthy body is less likely to experience problems like frequent nosebleeds.
Right. So if I'm hearing you correctly, like the best approach is to, focus on those evidence-based prevention strategies we talked about, staying hydrated, using a humidifier if needed, avoiding nose picking, and maybe incorporating that saline nasal spray into your routine.
Exactly. I mean, those are your best bets for preventing those pesky nosebleeds. And if you are concerned about, frequent or severe nosebleeds, it's always best to, consult with your doctor to rule out any underlying medical conditions.
Okay, great advice. Now, I know we've covered a lot of ground here. Is there anything else you think is important for our listener to remember as we kind of wrap things up?
I think the key takeaway here is that knowledge is power.
Mm.
The more you understand about your body and what might be contributing to those nosebleeds, the better equipped you'll be to manage them effectively.
I love that. So let's do a quick recap of the key points before we wrap up this deep dive. All right, so just to like recap what we've learned. Nosebleeds or epistaxis are pretty common.
Yeah.
There are two main types, anterior and posterior.
Right.
And the anterior ones, the ones happening in, the front of your nose, those are usually no big deal. And
Yeah.
you can usually handle them at home with some, basic first aid.
Absolutely. And we talked about, some of those common causes for those anterior nosebleeds, things like dry air, allergies, even picking your nose.
Right, right. So those are all things you can, kind of be mindful of and potentially address with things like, staying hydrated, using a humidifier, saline nasal spray, all that good stuff.
Exactly. Prevention is always better than a cure.
Right. But we also learned that sometimes nosebleeds can be a sign of something a little more serious, like high blood pressure or a blood clotting disorder. And those posterior nosebleeds that we talked about, the ones originating further back in the nose, those can also be kind of a red flag.
Yeah, definitely. So if you're having, frequent nosebleeds or heavy nosebleeds or, if you have any concerns at all, really, it's always best to check in with your doctor. They can help determine what's going on and make sure you get the right treatment.
Absolutely. Great advice. Now, before we wrap up completely, I wanted to touch on one more thing that I found really fascinating. We talked about honey as like a potential natural remedy. And while the source, really focused on its benefits for oral health, it kind of got me thinking about the bigger picture.
Oh, I'm glad you brought that up.
Yeah.
I think it's such a great example of just, how interconnected our bodies are.
Right.
We often think about our
Yeah.
health in these like separate systems,
Yeah. Yeah.
but really everything is linked.
Exactly. So even though there's not like direct evidence linking honey to nosebleed prevention, the fact that it has, those antibacterial and anti-inflammatory properties, and the fact that it can be so beneficial for oral health, I don't know, it makes me think that it could have like a broader impact on our well-being.
It's certainly worth exploring, and I think it speaks to the potential of natural remedies for supporting our overall health. Of course, with anything, it's important to do your research and talk to your doctor and proceed with caution.
Totally, totally. So as we wrap up this deep dive into the world of nosebleeds, I want to leave you with this final thought. Don't underestimate the power of knowledge and observation. Pay attention to your body, be mindful of those, potential causes that we talked about, and don't hesitate to seek professional advice if you have, any concerns at all.
Well said. And remember, your health is a journey, not a destination.
Oh, I like that.
There's always more to learn, and new research is coming out all the time. So stay curious, stay informed, and just stay proactive in taking care of yourself.
Beautifully said. And thank you so much for joining me on this fascinating deep dive. Until next time, stay healthy and keep exploring.